Let us now go to visual diagnosis of the skin. We will be looking at a case history of eczema. A 29-year-old woman had been suffering from atopic eczema since she was a few months old. The manifestations were typical of atopic eczema: a dry, red rash, scaliness, thickening of the skin, and intense itching. The location of the eczema was only on the top part of the body. The eczema became worse during a pregnancy and after childbirth. Her eczema was also aggravated with a cyclical irregularity every 7 years. Her tongue was slightly red with red points on the front part and a stomach crack and not enough tongue coating. Her pulse was very weak on the right front position and overflowing on the left at the middle level. She was very thin and restless, tapping her fingers on the table as she talked. The immediate presenting pattern of the eczema is empty heat in the blood with wind heat in the skin. The empty heat in the blood is manifested by the red dry rash and the red of the tongue without enough coating. The wind heat is manifested by the intense itching and the location of the eczema on the top part of the body. There is also a yin deficiency of the lungs and stomach, manifested by the stomach crack and the weak pulse on the right front position. The yin deficiency is also manifested by the thin body and by her restless behavior, like tapping her fingers on the table as she talked. Underlying this, there is also a deficiency of the defensive qi systems of the lungs and kidneys, especially of the lungs. This is manifested by the weak pulse on the right front position and by the aggravation of the eczema during pregnancy and after childbirth. An interesting feature of this case is the cyclical aggravation of the eczema every 7 years, which is in perfect accordance with the Chinese view on 7-year cycles in a woman's life as described in the first chapter of the Simple Questions. Thank you so much for your attention.